Welcome everyone. My name is Nigam Arora. I am the Publication Committee Chair for the Cannabis Chemistry Subdivision of the American Chemical Society. So we're really happy to hold our first Journal Club session of this season. We've got some more great speakers coming, so please stay tuned for future sessions. A little background on Journal Club. It's the only international journal club of its kind at this point. It focuses on recent peer-reviewed publications in cannabis science and is open to the public free of charge. We hold sessions monthly, and we broadcast on Zoom via Terpenes and Testing magazine's website. So we're very blessed to often have authors of papers themselves present here at our journal club. And this month we are honored to have Dr. Ethan Russo with us presenting on his recent publication. So little background on Dr. Russo. He is a board certified neurologist with specialization in child neurology and 20 years of experience in clinical practice. In 2013, Dr. Russo began working with GW Pharmaceuticals, developing prescription pharmaceuticals from cannabis plant. So I'm sure most of us are aware that that has gone well and is on the market now. Continuing, he in 2015 became the medical director of PHYTECS, a company focused on optimization and function of the endocannabinoid system. Currently, Dr. Russo serves as Director of Research and Development at the International Cannabis and Cannabinoids Institute. He's also fairly prolific with his writing and is putting out peer-reviewed publications quite often. So today, very excited to hear Dr. Russo talk about his recent publication titled "The Case for the Entourage Effect in Conventional Breeding of Clinical Cannabis, No Strain, No Gain." So with that, I'd like to go ahead and pass the mic to Dr. Russo. Dr. Russo, can you go ahead and start presenting?
Sure will.
Great.
One correction, I was actually with GW Pharmaceuticals from 2003 through the end of 2014. All right, so I'm going to try and put this on full screen.
That would be great.
It's not doing it, however.
I think it's it's in the bottom right.
Okay.
Yep, that's the one.
Yeah, the one on the top didn't work. Anyway, welcome to everyone attending the webinar. The content of this will be mainly contained in two papers, Taming THC from 2011 and 2019 publication with pretty much this title, Cannabis Entourage Effect and Conventional Breeding, No Strain, No Gain. So let us begin. Of course, we're talking about cannabis sativa, cultivated cannabis, the most useful single plant on earth, providing as it does food, fuel, fiber, and of course pharmacy, which would be the main subject of interest today. This is a dioecious plant, meaning that it has sexes on separate plants. Quite interestingly, this is an annual. It can grow 6 meters or more in a single season from seed, so a really prolific plant as well. Of course, things start with the unfertilized female flowers. These produce glandular trichomes. The capitate glandular trichomes are what you see in the middle panel at the top. Of course, these produce THC. This binds to the CB1, cannabinoid-1 receptor. THC is quite analogous to anandamide, an endogenous cannabinoid in its function, in that both are weak partial agonists at the CB1 receptor. 2-arachidonoglycerol, another endocannabinoid, seems to be a full agonist, although there's some debate about that. So a lot of what we know about the endogenous cannabinoid system is a result of research on cannabis, and this is relatively new science. Really, things were not established until the beginning of the 90s in terms of this. So the endocannabinoid system is formed of three components: the endogenous cannabinoids themselves, the receptors that bind them, and the biosynthetic and catabolic enzymes that make them and break them down. We have this concept called endocannabinoid tone that would be a function of the endocannabinoid levels, the status of the receptors and the enzymes. Cannabis is also an ancient medicine, and we have a representation in several ancient languages. Here I would point out just a couple. The Chinese, which is a pictograph, basically showing stalks of hemp hanging upside down in a shed to dry. And down at the bottom we have cannabis, which gives us our English form of the word, derived from the Greek. Some of the other languages are close, cannabosum, Aramaic cane in Hebrew, quite close. One of the big issues in cannabis is speciation. Is this one species or is it separate species, as many have maintained? A good guide to usage takes into account the chemistry of the plant, and this is a classification I'd like to see used more often. Actually originated with Ernest Small back in the 70s. So type 1 is the most familiar high THC type cannabis. Type 2 would be mixed with roughly equal amounts of THC and CBD. We're seeing more of these on the market. The type 3 are relatively new to the market. These would be CBD predominant chemovars. And we will be using the term chemovar, chemical varieties, rather than strains. There are no strains in plants. Rather, strains is a term that applies to bacteria and viruses. It is part of the common parlance, but that doesn't mean that it's correct or should be perpetuated. As mentioned, there is a debate about whether there's one or more species. Linnaeus, of course, was famous for producing the binomial nomenclature of Cannabis sativa, but he didn't originate that name. We have it 250 years earlier with Leonhard Fuchs in Germany. But after Species Plantarum was published in the 18th century, 25 years later, Antoine Lamarck on the right described what he felt was a different species, what he called Cannabis indica. This was an accession from India, but as you'll notice, it was a bushier plant, but with narrow leaflets, and does not resemble what people commonly call indica today. Rather, those plants, which are squat, 1 meter in height or so, with wide leaflets, often derived from Afghanistan, and another label, Cannabis afghanica, has been applied to those. But it is important to understand that morphology does not predict the biochemistry. This was complicated by one of my mentors, Schultes at Harvard. In 1974, he published this article showing 3 purported species of sativa, indica, and ruderalis, the latter being an unbranched, less than 1 meter plant that grows by roadsides and was originally described by Vavilov in Russia. You see Professor Schultes on the right in Afghanistan. This is not something you should try currently, but that would be a typical plant called an indica today. Although again, that seems to be a misnomer and doesn't resemble what Lamarck described. Just to add to the confusion, we see David Watson here with a plant of Chinese genetics that produce very large seeds. But if you see the close-up in the upper right of the leaflets, these are wide, indicating a so-called indica. But this is actually plants of the Far East retain a fair amount of THC. Then we have a picture from the Rif Mountains in Morocco, a field of cannabis. Because of the growing conditions, these are unbranched 1 meter plants that resemble ruderalis. But again, these are drug plants, and in this instance, type 2 having equal amounts of THC and CBD as far as the field goes. Um, in the last decade, Hillig did some work trying to separate the species based on the biochemistry. And if you see the scatter plot here, he was able to identify different types of cannabis, but it wasn't the cannabinoids that made the difference. The best demarcation between chemovars came from the terpenoid content, as you see here. Another classification that was advanced by Clark and Merlin in their excellent book was broad leaflet drug, narrow leaflet drug, narrow leaflet hemp. So this is a functional description of how the plant is used. This hasn't gained a lot of traction, however. And again, Earth Small has developed this model with subspecies and some definitions based on the chemical content. Again, this is confusing to most people. And my personal bias is that description of the biochemical content is what's needed. Again, more recent work trying to show a demarcation. Aside from the cannabidiol predominant chemovars, almost everything tested expressed high THC. And once more, as was noted a decade earlier, the easiest way to demarcate from one type of cannabis and another is the terpenoid content, something that not all people agree is important. Here's a close-up of a capitate glandular trichome, and on the left you're able to see this nice spherical structure that contains the cannabinoids and terpenoids with at its base the secretory cells that produce them. This is held away from the plant because this material, the cannabinoid acids, are actually toxic to the plant itself, and these will rain down on fan leaves and cause a pruning as the plant senesces. These are in contrast to the sessile glandular trichomes from the leaves, which are actually much tinier in the volume that they contain and are chemically heterogeneous as compared to those in the unfertilized female flowering tops. This is a picture from a 2017 book chapter that was done with Jehan Marcoux on cannabis pharmacology, trying to show that the flowers are not the only chemically interesting part of the plant. So again, you see the capitate glandular trichomes in the upper right. We've got the fan leaves that produce much, much less in the way of cannabinoids. So something like 18 times less than what are in the flowers. However, they also are interesting in that they can produce an anti-inflammatory compound called cannaprine that to date has not gotten a lot of attention. If a plant is fertilized, as in the middle, the cannabinoid content is cut in half or more. Of course, the seeds are very interesting from a biochemical standpoint. They don't have cannabinoids or terpenoids, but they do have a large amount of a highly digestible protein called eudestin and an oil that's very rich in fatty acids as well as some other anti-inflammatory compounds. Then at the bottom, we've got the roots. No cannabinoids to speak of, but they do have triterpenoids and alkaloids that are not found elsewhere in the plant. So until recently, all the chemovars of cannabis in the USA were uniformly high THC, and it still remains the case in many areas where CBD has not quite penetrated the gene pool or the breeding pool. So if consumers are correct that there are really differences between one type of cannabis and another and their pharmacological effects, it's not from THC content or even ratios, but rather the terpenoid content. This is the biosynthetic pathway of cannabis. Our two most important agents are on the second row, the olivotolic acid and geranyl pyrophosphate or diphosphate. So these are the parent compounds to the cannabinoid acids, and the acids are the the chemicals that are produced predominantly in the plant, and it's only later that these may spontaneously decarboxylate with loss of the CO2 group here, or especially under heat when they're smoked, vaporized, or baked. We have predominantly two dominant enzymes, THCA synthase and CBDA synthase, leading correspondingly to the production of THC and CBD, initially in acid forms. A recessive trait is CBCA synthase that eventually will produce cannabichromene. But that's not all. Geranyl pyrophosphate can alternatively combine with divernic acid with 3-carbon propyl side chains to produce the varin series. So these are propyl acid cannabinoids that are also pharmacologically very interesting. Additionally, geranyl pyrophosphate is the parent compound to the monoterpenoids, starting with limonene, and also to the sesquiterpenoids. So what are terpenoids? These are the aromatic compounds in plants, particularly in cannabis. The cannabinoids actually have no odor at all. They're formed of 5-carbon isoprene units. Terpenes contain only carbon and hydrogen, whereas terpenoids also contain oxygen. So all terpenes are terpenoids, but not all terpenoids are terpenes, and this is confusing. I like the symmetry of terpenoids and cannabinoids and find that a more encompassing term. Monoterpenoids are the lower molecular weight 10-carbon units, such as limonene, pinene, and myrcene. Sesquiterpenoids also come from the tops, especially caryophyllene, which will predominate in most extracts. There's only one diterpenoid, phytol, that's a breakdown product of chlorophyll. And the triterpenoids, as mentioned, have 30 carbons and are only found in the roots. Fridolin would be one example. Terpenoids are actually the largest group of plant chemicals. Over 20,000 have been characterized. So there are a lot more of these than there are alkaloids, which we usually think of as the predominant plant chemicals used medicinally. These are produced by the plant in variable complex mixtures for ecological reasons. For instance, they may attract beneficial bugs and repel or even kill predators. They are very expensive metabolically for the plants, so they weren't there just to make us high or to produce pleasant aromas. As mentioned previously, these are synthesized in sequestered structures like the capitate glandular trichomes. Most terpenoids are highly lipophilic and cross the blood-brain barrier. Many of these can cross the skin, whereas the cannabinoids do so very poorly. Monoterpenoids are more volatile, and these produce the headspace volatiles that one will smell on approaching a growing plant. Terpenoids are under genetic control, but very subject to environmental influences. To make things complicated, some enzymes are promiscuous, what Professor Michelin calls the law of stinginess, what I call enzymatic substrate promiscuity. So one enzyme can produce up to 5 different terpenoid products. It's thought that these complex mixtures may confound predators as a defense mechanism. The constituents may be additive or synergistic in their effects. And the mixture of mono or terpenoids or sesquiterpenoids decides the viscosity. And that may be important in trying to trap insects. For when the trichomes are breached, they will polymerize. These are produced in greater amounts with increased light exposure, but will decrease if the soil is too fertile. This is an explanation for why the poor soils of Provence and France produce the best lavender essential oils. And these are also pharmacologically active and very potent. Some interact with cell membranes, some react with ion channels, some act directly on receptors. So there's some complex pharmacology going on here. Although these are produced in very small amounts by most plants, it's felt that anything above a 0.05% concentration may have pharmacological activity. All the ones we're going to discuss today are GRAS, generally recognized as safe. Now, one area of controversy surrounds the use of gamma irradiation to produce sterile cannabis and get rid of pathogens like E. coli. It has been shown that caryophyllene, an important medical component, can be decreased by as much as 10% due to gamma irradiation. It certainly is possible to do clean culture of cannabis, obviating the need for this step. Just a couple other factoids. Pinene is the most widely distributed terpenoid in nature, and limonene is second. However, in most current chemovars of cannabis, these are not very common and actually are supplanted by high concentrations of myrcene, which can be quite sedating. This is a apparently not very clear panel from the Taming THC article from 2011. Basically, rather than the fine print here, I'm showing that none of the terpenoids in cannabis are unique to it, and rather will appear in more common plants such as citrus, pine needles, hops, lavender, etc. On a medical side, the terpenoids are most important as analgesics, anti-inflammatories, mood enhancers, and some modulate the effects of THC, and so are synergists with cannabinoids. A lot of this we've discussed already. You see in the upper panel, these are bugs, aphids that have all 6 legs caught on glandular trichomes. I've mentioned that we get a little chemical diversity. The sesquiterpenoids are going to appear in higher concentrations than the leaves and act as a feeding deterrent for grazing animals. A lot of the early studies that were done on cannabis terpenoids were mainly to list what was found, and it was only about in the late 90s, early 2000s that people like John McPartland and I became interested in their biochemical contributions, pharmacological contributions to cannabis. This is an interesting old study from 1993. What was done here is mice were exposed to terpenoid odors for an hour, and they looked at how much they moved compared to baseline. So linalool, which is in lavender and cannabis, has a sedative effect on the rodents and reduced their movement 73%, even though there was only a low serum concentration. For orange terpenes, primarily limonene, there was an increase in activity. That has an antidepressant effect. But this is interesting because there was no detectable serum concentration. Presumably by that time, all the action was in the brain, and what was in the blood had already been metabolized. Alpha-pinene increased activity, and terpineol decreased it. So obviously these are having direct effects pharmacologically on the brain, even in very low concentrations. This is, again, from the Russo chapter. These are the primary monoterpenoids found in cannabis. We'll only be discussing a few specific ones today. We'll start with alpha-pinene. Again, most common terpenoid in nature, but not seen in very high concentrations in most available chemovars of cannabis. This is anti-inflammatory, mediated via prostaglandin E1. It's highly bioavailable on inhalation. We know this from studies that were done in sawmill workers in Scandinavia. It does have a bronchodilating effect, as does THC, and it's interesting to note that cannabis cigarettes were marketed in the 19th century for asthma. It has wide spectrum antibiotic effects, primarily against gram-positive organisms. It also was shown to protect rat astrocytes from damage by hydrogen peroxide. But its most important pharmacological effect is as an acetylcholinesterase inhibitor. So let's imagine a scenario. Someone has chronic pain, so they use cannabis for it, but they either work or study and need to be able to function without short-term memory impairment from THC. Because alpha-pinene reduces the breakdown of acetylcholine, the memory molecule and neurotransmitter in the brain, this can reduce or eliminate that short-term memory deficit. So this is a highly desirable component of cannabis use therapeutically, at least during the day. More common is myrcene. This can be found in celery leaves. So I'll give you a sense of the odor. This is also an anti-inflammatory via prostaglandin E2 this time. This is sedating. It is a muscle relaxant and will prolong barbiturate sleep time. When combined with THC, there's a synergy of this sedative effect, and this is the primary couch lock factor in cannabis. Interestingly, the analgesic effect of myrcene seems to have relationship to narcotic drugs and is antagonized by naloxone, the mu-opioid blocker that's used in treatment of overdoses. So this is a useful component from a medical standpoint, but is far and away the most common terpenoid found in commercial cannabis varieties, often in the excess of other things that would be more therapeutic. Excuse me. Another important one that we don't see enough of, I believe, is D-Limonene. This will be very familiar to everyone as the primary scent component of citrus. And if you rub your thumbnail across a citrus rind, you'll get release of a bunch of D-Limonene. This is well known as a potent antidepressant and immune stimulator. There was a study out of Japan, Komori et al., some 25 years ago, showing that just wafting this into the air, they were able to cut Hamilton depression scales scores in half and allow hospitalized psychiatric patients to discontinue their antidepressant treatment. This also is effective against skin fungus, dermatophytes. Was tested in a phase 2 study, very high doses, women with breast cancer, but they were very, very advanced with their disease. And on its own, this did not prove to be that effective. I think combining with cannabinoids as a synergist, we would see things quite differently. It also is an agonist at the A2A adenosine receptors and could synergize with THC and CBD that have similar activity. A very interesting one is at the bottom. In a high concentration, this increased mitochondrial biogenesis and was able to turn white fat, the storage fat, into brown fat, the metabolically active fat, implying a possible role in treatment of obesity in the future. Linalool, we've mentioned before, as being sedating in rodents. This is going to be very familiar as the main scent in lavender. This has been actively researched on the strong anti-anxiety agent. It's been used clinically to treat agitated, demented patients with Alzheimer's disease. It also is a very strong local anesthetic, equal to procaine or menthol, and is an anticonvulsant and anti-glutamatergic agent. In relation to the former, some of my colleagues who treat a lot of children with epilepsy with cannabis have noted a progression from lack of control to control of the seizures when linalool has been present. Another common one, especially in California chemovars, is terpinolene. If you want to know what it smells like, smell parsnip at a much neglected vegetable at the grocery store. This is able to prevent LDL oxidation, so it might be useful in treating atherosclerosis. Interestingly, this is sedative in mice, but usual reports of terpinolene predominant chemovars is that these are activating, and producing a stimulating effect, and this could be attributable to its commonality with alpha-pinene and being a cholinesterase inhibitor. And it has various other activities. Now we're going to switch to sesquiterpenoids. So these are the 15 carbon agents. Most important is beta-caryophyllene. This is a fascinating molecule. It is common to black pepper as well as cannabis. It's been known for a long time that this is anti-inflammatory via prostaglandin E1. It's comparable in its potency to phenylbutazone, a non-steroidal anti-inflammatory, so strong it's used in horses, but it's not approved in humans. And apparently essential oils with content of beta-caryophyllene have been equivalent to the prescription NSAIDs, etodolac and indomethacin. In contrast to the NSAIDs, however, beta-caryophyllene actually protects the stomach from ulcers, a gastric cytoprotective. The reason beta-caryophyllene is so interesting is it's not just a terpenoid, it at the same time is a cannabinoid, because this has been shown to be a selective full agonist at the CB2 receptor. So that's the non-psychoactive receptor that mediates peripheral analgesia and anti-inflammatory effects. Additionally, CB2 agonists have decreased cocaine administration in addicted lab animals, and is believed that caryophyllene can do the same thing. Additionally, CB2 agonists inhibit hepatic fibrosis and the formation of scar tissue elsewhere. So certainly these would be interesting agents in cirrhosis and other diseases with excessive fibrotic activity. Its close counterpart is caryophyllene oxide. Two things distinguish this. I'm not sure how many people are familiar with lemon balm, Melissa officinalis, but a lovely scent. This seems to be the agent that sniffer dogs use to identify cannabis. Additionally, it's a very strong antifungal. It works on nail fungus. There is a prescription agent where it costs $3,000 to treat one nail for 6 months with a 50% likelihood of cure. Reportedly, an 8% concentration of caryophyllene oxide produced cure in just 2 weeks. So what's wrong with this picture? Another important sesquiterpenoid, often found in conjunction with beta-caryophyllene, is humulene. So it is common to hops, and sometimes is a predominant terpenoid in North American chemovars. However, we really don't know what, if anything, this does psychopharmacologically. I got excited recently because I found an article, 20 pages of the pharmacology of hops, and there was nothing to speak of in relation to humulene. So there's a graduate student project for someone. Now, it is the case that selective breeding has produced cannabinoid-free plants. You see an example on the left. That's what the plant looks like. And if we have a close-up of the trichomes, they're shrunken. So they've got terpenoids. It has scent, but no cannabinoids. Now, some people have spuriously attributed these as being good candidates for placebo. I highly resist that characterization because The remaining terpenoids are pharmacologically active. So these could be used as comparators, but to say that they're placebo is just plain incorrect. On the other side of the coin, it has been possible to selectively breed for terpenoid content. Attenda Meyer at GW Pharmaceuticals has produced plants where 77% of the monoterpenes were limonene or 97% as myrcene, although I'm not sure that would be attractive in the recreational market. This is a chart from a book of mine published in 2001, basically looking at the psychopharmacological effects of various essential oils, and some of the agents that we've already discussed are components of these. But just to suggest some possible applications in the psychopharmacological realm. To treat depression, we know that low doses of THC can be helpful. CBD can be as well, particularly combined with limonene. For anxiety, CBD in high doses will do it, but with a little limonene and linalool will likely be much more effective. For sedation, as mentioned, THC plus myrcene is clearly effective. On treating agitation or Alzheimer's disease, THC and CBD with linalool and possibly limonene and pinene. For sleep, THC plus any combination of linalool and myrcene. For addiction, CBD plus caryophyllene plus minus THC. Again, in low doses, this certainly seems to help treat addiction to other substances. So how would we best characterize things, to come back to one of the earlier themes? Well, it'd be good to describe the plant, what its shape, content, and purpose are. We might want to use Small's classification, type 3 for hemp with CBD predominance. We're also interested in the shape of the plant, whether it's got broad leaflets, whether it's compact, tall, or spindly. We definitely want to know the cannabinoid and terpenoid content, and we'd be interested in the scent and taste when vaporized, but especially the uses and effects in patients. So one of the best systems I've seen is that developed by Mark Lewis at NAPRO Research. This is called PHYTECS. From the top, you see the percentage of cannabinoids, the percentage of terpenoids, the moisture content, a donut with the top 2 cannabinoids, a listing of the concentrations of the top several cannabinoids, a picture of the bud. Then where it gets interesting is the aromas and flavors, and then representative plants that might give you hints, in this case lemon and pepper for citrus, limonene and caryophyllene, and those are correspondingly shown in these bars. This is the limonene and caryophyllene with their percentages. And then the entourage effects, or the description that consumers have placed on these. Comfort, inspiration, not a lot of sedation. Now we'll get some other examples here. Harlequin is a chemovar of cannabis that was one of the early CBD type chemovars, but its THC to CBD ratio is only 1 to 2.2. And this is the way that it's usually done scientifically. A lot of people flip this around to have CBD to THC, but this is the way it should be. This particular one had a low terpenoid titer overall, but was very high in myrcene, as we see here. So this is the kind of agent that creates a misimpression that CBD predominant chemovars of cannabis are sedating. They are not. Rather, CBD on its own is actually a stimulatory effect, and it's only at extreme doses, particularly in polypharmacy, that sedative effects will predominate. What if you want myrcene? Well, we can produce 3.44% of it alone out of a total of 4.8% total terpenoids. That is one oily plant. But it's rich in everything. You see the cannabinoids are 25% total. It is CBD predominant, roughly, but type 2 plant because they're almost equal amounts of THC. This is very relaxing. I think that might be a euphemism. I think sedative would be a good description. Now, in contrast, what if we had a type 2 balanced plant that was pinene dominant? So this would be a non-sedating alternative. Again, the pinene will reduce short-term memory impairment from the THC, hopefully allowing better focus and concentration. And the pinene is 2% here out of basically half of the 3.9% terpenoid total. And you see that here. The alpha pinene in the green is a long line, whereas the myrcene is less than half of it. So consumers have noticed good focus with this, much less in the way of other attributes, and having a very piney scent. This one I find fascinating. It's a good demonstration of what selective Mendelian breeding with no CRISPR technology, no genetic modification is able to do. Let's start at the bottom. We see that we have 3 examples of a pinene predominant plant, relatively low myrcene, but the cannabinoid content is varied. What we've got here is type 1 THC predominant, type 2 equal amounts of CBD and THC, and type 3 CBD predominant. So one can breed in a way to have a retained terpenoid profile with different cannabinoid content to match the needs of the patient. So this is a very important concept, and I would emphasize that these were not one-offs. These were not one plant in 10,000 that was found to have the pattern desired, but rather all of these are vigorous plants that breed truly and could be easily reproduced. Same thing again, we've got retained terpenoid profiles, this time with high limonene, and actually high amounts of caryophyllene and linalool, moderate amounts of myrcene, and again, type 1 plant, type 2 plant, type 3 plant. And a final example of the same thing is we've got caryophyllene predominant plants. In this instance, we've got a combination of THC and THCV. THCV is a neutral antagonist of the CB1 receptor and will produce decreased appetite, improvements in the metabolic syndrome and type 2 diabetes. We have a type 2 plant with equal CBD and THC, and this one's a special type 3 plant. It's got equal amounts of cannabidiol and cannabidivarin. Cannabidivarin, of course, is the propyl analog of CBD, and it is useful as an anticonvulsant for seizures of partial onset, focal seizures. Another example, this is a type 2 plant. It's got balanced amounts of limonene, linalool, and caryophyllene. Patients say that it produces calm and inspiration. And this could be used for a lot of different things. It'd be useful in treating burns, but also epilepsy because of the linalool combined with high CBD content. This is a type 3 CBD predominant plant where the second most common terpenoid is cannabigerol. And this is caryophyllene predominant with almost no myrcene at all. So it's also quite low in THC, rich in caryophyllene, limonene, and humulene. Patients report comfort, making this likely useful for pain, inflammation. Because of the combination of CBD and caryophyllene, it also should be useful for addiction treatment and for anxiety and depression. This is a type 3 plant. Again, top two cannabinoids are cannabidiol and cannabidivarin. It's got a low amount but present THC, so a small amount, and it's got linalool. So basically, this has got 4 anticonvulsants in it, and the caryophyllene as a strong anti-inflammatory might help as well. So I think this would be a useful plant to develop as a treatment for epilepsy. Coming towards the end of the presentation, I wanted to show the difference between flower content and an extract, and this is done via CO2 extraction. So as we start out, we've got 20.5% cannabinoids with 2.2% terpenoids, a moderate amount. Caryophyllene is predominant, but with a good amount of humulene, and limonene, moderate amount of myrcene. So basically, to start, the terpenoids are about 10.7% of the cannabinoid content. And we've got caryophyllene and limonene dominant. In the extract, however, you get the cannabinoids way up. You've more than tripled them to 71.6%. But the terpenoids have increased only marginally to 2.4%. So at this point, the terpenoid content is only 3.4% of the cannabinoid content. It's a third of where it was before. And caryophyllene remains predominant, but now humulene as well. This points out a problem with a lot of the CO2 extraction, is that it's done in one pass and squanders the amount of terpenoids. I think that this needs to be done differently, preferably with 2 passes where the terpenoid fraction is added back in. Alternatively, cold ethanol extraction may better preserve these ratios. This is a plate from this article published earlier this year. And it shows again the biosynthetic pathway, which is now familiar to you, and what other organisms can do it. Interestingly, cannabigerolic acid and cannabigerol have been found in a South African daisy called Helichrysum umbraculagera. As for the others, through genetic modification, the THCA synthase has been produced in 3 species: Nicotiana tabacum, tobacco plant, Spodoptera frugiperda, which is an insect, and then in a yeast, Comagatella paphii. Additionally, Saccharomyces have produced monoterpenoids and sesquiterpenoids. 2 weeks after this article came out, an article was in one of the Nature journals by Luo et al., in which they'd used something like 55 steps to have yeast produce each of these cannabinoid acids. However, the caveat I would introduce is twofold. Number one, the amounts produced were tiny, perhaps 1% of what the plant can produce. Number two is they never will be able to produce the entourage of cannabinoids and terpenoids that come from the plant. So I call this parlor tricks with yeast. And I'm sure this will provoke a lot of arguments, but I remain firmly in favor of conventional breeding of the plant. Nature does it better. And I want to close with a word about lamb races. So lamb races are chemovars of cannabis that have been grown for multiple generations in a specific geographical area, so they're ecologically adapted to local conditions. Obviously, land races are going to grow better than the newly hybridized plants that have replaced them in traditional cannabis growing areas like Mexico, Southern Africa, Jamaica, Colombia, Morocco, Afghanistan, and Thailand. In the process, we've lost a lot of wonderful and advantageous traits, and I'm hoping that some of these land races remain that can be grown and reintroduced to the gene pool to make cannabis safer and better. And with that, I will thank you, and I guess we'll open it up for questions.
Yeah, thanks so much for that presentation, Dr. Russo. Really interesting stuff. I will start it off. We got a question from one of our attendees, Wyeth Calloway. So I'll go ahead and read his question here. So question is that we know the smell of cannabis essential oils cannot be mimicked by mixtures of commercially available terpenoids. So cannabis-derived essential oils are an alternative in formulations. When trying to predict the properties of these complex oils for formulation, should one focus on the major terpenoid content, and how should one evaluate the influence of minor components, less than 0.05%?
Great question. First, I think people should try an experiment where they get help from someone to line up a lemon, a lime, an orange, and a grapefruit, and blindfold yourself and see if you can tell the difference. I think the vast majority of people can. So what you would find upon analysis is they all have predominant limonene, and it's going to be minor components like nerolidol and others that distinguish the scents. And although we're not as good as dogs, we really are very sensitive to these differences. So even tiny amounts can influence the scent and may influence the pharmacology. What we typically see in terpenoid content in cannabis is that you get 3 to 5 that are really predominant, and then they're very small amounts of the others. Remember the 0.05% concentration. Anything there or above could be pharmacologically active, but we're going to be most interested in the predominant ones. I agree that you really are unlikely to blend 20 or more different terpenoids to try and reproduce a genuine cannabis essential oil. And I'm hoping that the laws will change in the United States so that steam distillation of cannabis essential oil will be possible. And these would be the proper way to supplement extracts, if that's a desired approach. What I'm dead against is using artificial flavors to be added to cannabis extracts to produce some kind of experience. I think the experience may be a bad one, and particularly in light of the problems that have been attendant with vape pens, possibly due to vitamin E acetate or other additives. We should definitely stay away from that. So thanks for the question.
Yes, I agree. Great question. And just as a follow-up that Wyatt had also posted, he's asking, and I think this is a common thing in the industry, if it's makes sense for people to try to recreate the flower by blending isolates of terpenes or terpenoids separately. Do you have an opinion on that, Dr. Russo?
Well, it can. Again, that is far better than trying to dicker with other agents. Now, so worst is artificial flavors, anything bought from Sigma Aldrich that's not pure and not designed for human use. That's the worst. Better would be organically derived botanical sources of pure terpenoids, such as available from True Terpenes in Portland, Oregon. Preferable yet would be selective breeding of cannabis to produce the terpenoid profiles that are desired. Unfortunately, very few breeders or companies have the wherewithal to do that or take the time, money, and effort to achieve that goal. But that would be the most desirable.
Got it. And looks like Wyeth is saying that they actually do use cannabis-derived, so that makes a lot of sense. Cool. So I'd like to shift gears a little bit and ask a separate question. So Dr. Russo, you had mentioned some of the benefits of alpha-pinene to patients, and I'm curious, has that been put into certain formulations or used for patients' benefit in a practical sense in your experience?
Well, in the limited areas where this kind of thing is available, again, the NAPRO research examples, they've been available in certain dispensaries in California and Washington, D.C. The feedback from patients is very much in keeping with what I've described. And I would mention at this point that there have been a lot of detractors to the concept of the entourage effect in cannabis. But there are what we hope will be definitive experiments underway now at Johns Hopkins to assess synergy of cannabinoid and terpenoid components. And these would be randomized controlled studies, double-blind, all that good stuff, in experimental subjects with advanced psychometric testing before and after exposure to try and show salient differences. So we hope that in the next couple of years, we'll have the kind of ammunition to support the contentions that I've advanced in the lecture today.
Got it. Yeah, that makes a lot of sense. And I'm just curious, is there a certain lab or core at Johns Hopkins that's going to be doing that work? I'm so interested to follow.
Yeah, I believe this is available on clinicaltrials.gov. The principal investigator is Ryan Vandrey, V-A-N-D-R-E-Y.
Cool. Awesome. I'll look into that. Okay, so we have another question from an attendee, Paul Lessard. Thanks for the question, Paul. He's asking, is the entourage effect lost when cannabis with terpenes is ingested or used topically, since the cellular dilation or other induced effects are typically not present in these routes?
Yeah, another good question. So, skin. Cannabis extracts work great on the skin for skin conditions. We get a lot of people who feel that they get benefit on sore joints by rubbing it in. However, the time profile to me is very suspicious because people will often report instantaneous or couple-minute relief. I think that this is probably a counter-irritant effect. We know that the terpenoids, many of them pass through the skin and produce blood levels, as I didn't show a slide on percutaneous absorption, but an aromatherapy massage will produce serum levels of terpenoids. Unfortunately, cannabinoids pass through the skin very poorly, and I do not believe it's possible with patches or otherwise to treat a systemic disorder, in other words, an internal disease, with cannabinoids applied on the skin. Now, for oral, it's even more complicated. A lot of these compounds are rapidly metabolized by the liver. And it may be that they are relatively a little less effective taken orally, but keep in mind that usually because of extraction techniques and baking, if you can smell the terpenoids in your brownies, it means that a lot of it's been lost. So I think it's a combination of factors. I do believe that they're pharmacologically active orally, but they've got to be there in a concentration sufficient so that some of it gets into the blood and gets into the brain. But it's not a situation where people ingest cannabis preparations and are only getting THC. So it really depends on the concentration.
Got it. And As a follow-up to that, I thought your slide showing the serum levels of terpenes was really interesting. And I'm curious, in the one you noted had no detectable serum level was the one that seemed to have the greatest effect. I'm curious, is that a notable correlation that it's moving faster through the physiological system, or are there any conclusions to be drawn there?
Yeah, what you can conclude is these are highly lipophilic molecules, and you'd see an analogous situation if someone smoked or vaporized cannabis. We get a rapid peak in THC concentration in the blood and a rapid decline at a time where the person remains high. And it's because this is redistributed into the brain or other fatty areas and really isn't there to speak of in the serum. So we've got a lousy correlation between serum levels and what the pharmacological and behavioral effects are going to be. And this is one of the weak links in trying to judge impairment on the basis of serum level of cannabinoids. They just don't correlate, so it ain't like alcohol.
Yep, that's. I'm glad you said that. I was gonna have to say it, but you said it for me, so that's great. And I'd like to ask one other question. And just for attendees still listening, if you have any other questions, please do post them. I'll ask a couple more, and then if we don't have further audience questions, we'll conclude. But a couple other questions for you, Dr. Russo. One is obviously we're all aware of the popularity of cannabis extracts, and as you mentioned, not just the popularity, but some of the apparent risk with vape pens and cartridges. So I'm curious, in your work, from your perspective, what are the benefits, if any, of producing and utilizing a cannabis concentrate as medicine versus using a flower?
Well, again, great question. I think the advantage of vape pens are concealment, ease of use, and speed of use. However, that's rarely necessary medically. Unless someone has a sudden bout of pain and uses this as an escape mechanism from the painful bout, it really doesn't make a lot of sense, particularly due to the fact that most cannabis concentrates used in vape pens are THC preparations to the exclusion of almost everything else. In the Seattle area, I see vape pens with THC 75 to 90%, and it just leaves no room for the terpenoids. And I don't think that these are usually appropriate vehicles for medicinal usage. People are going to overshoot their dose. They're going to produce THC-associated side effects like rapid heart rate, anxiety, even orthostatic hypotension. The doses of THC that are necessary for most medical indications are going to be much, much, much lower than a person is likely to get even with a single inhalation on a vape pen.
Got it. Thank you for sharing thoughts there. So one other question I wanted to ask, let's call it one of two that I'm so curious to ask you. One is you had mentioned the plants that were bred to pretty much only be terpenoid plants. And you mentioned that they could be used as a comparator versus a placebo control. So that's interesting, but I'm curious, what was the motivation to make those plants? Is it to use it as a comparator? Is it to harvest the cannabis-derived terpenes from them? What is the point of that work?
Well, it would vary with different companies. I know specifically one company developed it as a placebo, but I as mentioned, I think that was scientifically inaccurate.
Got it. Okay, interesting. And then the last thing I wanted to ask is, you had touched on myrcene antagonizing the same receptors as naloxone. Is that correct?
No, naloxone antagonized the analgesic effect of myrcene.
I see. Okay, that's interesting.
So what it implies is that some of the analgesic effect was mediated via the mu opioid receptor.
Got it. Understood. Okay, so that makes sense as well. Cool. Okay. I haven't seen any other questions from the audience. So oh, actually we got one more. Hmm. Yeah, okay, so we'll ask this one, I guess. Wyeth is asking again if there should be a drive either from his production facility or from others to produce concentrates based on type 2 and type 3 plants. I think he's probably responding to what you commented about a lot of these vape pens being basically from the heavy THC plants.
Type 2, yes. Type 3, it's really hard for me to endorse that. I really don't know how people would titrate their dosage. Most people using vape pens are titrating to a certain level of psychoactivity. If we've got a type 3 plant with predominantly CBD and only a little THC, when do they stop? You know, again, even though it's better than smoking, vape pens still produce some throat and lung irritation. And I think that anyone that's using them medically would be better off using an oral preparation or an oral mucosal tincture in preference. So certainly those things could be developed. I'm just not sure how people are dosing them and whether it is being used appropriately.
Got it. And actually, a couple interesting questions coming in now. Mark Grossman is asking if there are any terpene preparations or preparations of terpenes that are commercially available and FDA approved. Can you speak to that relationship at all?
Oh, I don't think any of them are FDA approved.
I think that I agree. Yeah.
Yeah. So yeah, they're good ones and not so good ones.
Got it. Another interesting one for you here, and I'm really curious to hear your response. Jay Fry is asking the difference between entourage effect and ensemble effect. Do you see them as one and the same, or do you have a preference?
It's just semantics. The original term was entourage effect. I'm retaining that. It is an ensemble. Entourage implies that one or two of the stars, and they'd probably be THC and CBD. I think that's appropriate either way. But yeah, various people have advanced the term ensemble effect, but priority goes to entourage.
Got it. Yep, I've heard that more commonly, well, in your work especially. And then one more follow-up, Isabel Sherman is asking in response to what you had mentioned about people claiming immediate relief with topicals. She's asking if, let's see, in regards to terpene transmission through the skin resulting in immediate relief to joint pain for some people, is it possible that terpenes are recruiting THC and CBD that already resides in the patient's bloodstream to generate a quick response to topical applications?
Boy, I'd like to see how that worked. I'm skeptical.
Is it, yeah, I agree with you on that one from the source of the bloodstream, but what about from the source of the topical itself? Is there any mechanism that the terpenoids are assisting in that facet?
Well, maybe. Specifically, neurolodol is known to help carry things through. It's just a situation where if we look at the blood levels that have been attained through the skin with cannabinoids, they're just short of the mark of what you need. There was a clinical trial where a company tried to apply cannabidiol to the skin to treat seizures, and it failed. I mean, I could have predicted that one. I'm not a betting man, but I don't know if Las Vegas was taking odds on that one.
Maybe so. Yeah, very interesting stuff. And then one more question also from Isabel that I was just, took me a moment to comprehend myself here. She's asking a really interesting question. You were noting that there is a, in some of the stuff you were showing from NAPRO research, you were noting that the terpenoids is fairly stable across the different types. She's asking if that terpenoid content profile is actually a driver or a driver of consistency in the breeding techniques versus THC and CBD levels in that vein. Do you
Well,
have
it was
thoughts
the
on that?
former. You know, these were targets that in some instances were to my specifications. Yeah, the idea was creating certain profiles of terpenoids, and we started out with the premise that this was an important goal in breeding, not just anybody can produce THC or CBD, but getting those in conjunction with the correct terpenoid profiles for therapeutic use was the goal.
Got it. That makes a lot of sense. And I just got another question from John Abrams. Really glad to see John on here. His question is, can you comment on the observation that myrcene production may be primarily epigenetic and a stress response of plants like cannabis? What are the implications for cultivation control?
Well, yeah, again, these are produced by the plants under genetic control, but with environmental input. And so that premise may well be accurate. What the trick is to figure out how to get what we want and make the plant perform accordingly. One of the areas that I have advocated for additional research is the epigenetics of cannabinoid and terpenoid production. So at this point, we know a lot of the enzymes involved. We don't know how they're regulated in the plant. And this is the type of research that I'd like to see undertaken, and actually trying to get funding for studies of that exact type with that intent.
Got it. Yeah, I really enjoyed your comment earlier when you said, just kind of off the cuff, well, that's a fun project for some grad student somewhere. So we need more funding, more grad students, and more research. I think that's all a little bit obvious. One more question came in here, and I'm actually interested in this myself as I'm working with some nano-emulsion technology currently. Question is, any comments on nanotechnology regarding cannabinoids and terpenes? And I would like to add on to that, any concerns for safety with nano-emulsion based products coming out on the market, especially
Yeah,
water
I don't know
soluble?
about safety. I mean, there are two different ways these could be used. One is to try and solubilize cannabinoids, and that's mainly towards the recreational drink market. To me, this is a gimmick. I don't know that anybody's going to be able to show that there's a greater therapeutic effect. Maybe, you know, having a more potent effect or higher bioavailability is an issue if the commodity is that precious. You know, the current preparations, if they're given in the right dose, are going to work in an equivalent fashion. So I'm a little bit skeptical on that front. Now, another way they've been used is lipid nanoparticles, and these could focus therapeutic effects where they're needed. So areas of tumor, inflammation, infection, and I think that is a more interesting application of this technology.
Got it. Yeah, no, that's certainly interesting. And yeah, no, it's very interesting. Thanks for your response there. Oh, and I did want to chime in. We recently had a dedicated symposium at the CANN meeting at the National ACS conference in San Diego just about a month ago. And I was presiding along with Monica Villalpando over this session related to water-soluble cannabinoids. And I posed this question to the panelists during the Q&A session: what is the therapeutic benefit? Why is it better for the patient or a certain condition? And it was interesting that we didn't have a ready-made answer. So
Yeah.
I think that the consensus, I think that you are part of the consensus on that one.
Well, I'd add another cynical twist, and that is it's very good for establishing an intellectual property position, but greater therapeutic effect, I'm going to need to see that. So far, I have not.
Sure. No, I can only agree with you. We've got another question here that I think is interesting. It's related to your slide that you were showing the different molecular components of different parts of the plant via, you kind of schemed out, I think, the paper that you and Jehan had put out. Yep, that's the one. So question is, any progress on concentration of compounds in the roots? And then I guess I'm broadly interested beyond roots. What other things here show the most promise in your opinion?
Well, there are various people interested in roots. I haven't seen a lot commercially except on an artisanal level. Um, I think the seeds are an underutilized resource. A great food product. I'd mention that certainly. And then we've got things like cannaprine in the leaves. Yeah, there's plenty to work with there. We need to, again, have better legislation that allows us to develop these alternative products.
Totally. Yeah, no, I think it's very interesting to see where we go forward.
Yeah. And I just add here, because, given the audience, ACS, there are a tremendous number of industrial applications that would be possible here that we haven't touched on at all. This remains an area of great interest to me, and I hope that we'll be developing such products and really show the versatility of the plant. It's not just medicine per se.
Absolutely. I agree with you fully. We got another question here. I think this is from John McKay, I believe. He's asking, I thought we should ask this one. I think he's asking if you have thoughts on triterpenoids. Do you care to share some thoughts there?
Sure. Well, Natasha Riz and I wrote an article about roots, and we spent a lot of time talking about triterpenoids and their anti-inflammatory effects and anti-cancer effects. So these aren't in tremendous concentrations in the plant roots. However, this is a commodity that basically is allowed to rot in the ground or thrown away, and it just shouldn't be the case. There's some real medicine there, and the roots have had traditional uses for the same indications. I think that there's a great deal of synergy there. I've even heard of people making tinctures that combine extracts from the flowering tops with root extracts, and they're reporting great results. We don't have randomized controlled trials on these, but the anecdotal information is quite interesting.
Yeah, thank you for sharing thoughts. I wholly agree with you. A lot of wasted potential there in the roots and some of these other plant parts. So that'll certainly be interesting to see where that goes. All right. Well, those are all the audience questions, and I was happy that I was able to throw a couple of my personal ones in there. Dr. Russo, I'd like to thank you again for your time. And just thank everyone for joining and sharing questions and thoughts today. We'll be having another journal club around this time next month, so please keep an eye on social media and the email list as we go through that. So thanks so much, everybody, and we'll see you next month.